My name is Dr. Rajesh Rajani, and I'm from the Hinduja group of hospitals, and I specialize in interventional cardiology and structural heart disease. Friends, it is very important that your physical health, your mental health, your spiritual health, and your emotional health should be in one line, and that is where you're going to propel forwards. Today is a World Heart Day, and on this particular day, I'll be speaking to you about cholesterol or lipids, how it impacts your heart and your well-being. And I'm over here to allay all your anxiety, fear, and answer all your questions, and unmute your heart. This lipid, my dear friends, is levels of cholesterol going out of or abnormal cholesterol levels. The cholesterol, the lipid profile, basically is concealed by total cholesterol and its derivatives. So good cholesterol, bad cholesterol. Good cholesterol is high density lipoproteins, HDL, very fastidious molecule. It only comes up if you exercise yourself real hard, or maybe 1 glass of wine 5 times a week, only 1 glass, not more than that, red wine. LDL is a bad cholesterol. It's called low density lipoproteins, a very sticky molecule, the villain in the whole game of causing irregularity in the blood vessels. And because of that, you form plaques, then you develop heart attacks. Most of them, including the triglyceride levels, which triglyceride levels basically are genetically determined, and so is the HDL and the LDL, but triglyceride levels can also increase if you drink alcohol in excess or have a disease called hypothyroidism, and to an extent diabetes mellitus. The average age of heart attacks has come down remarkably. Now, if you go backtrack yourself to around 50 to 70 years ago, the average age of heart attacks may be around 65, 66, has come down remarkably to around 30 to 40 years of age. And why is that so? Stress has increased tremendously in this present era and generation. And at the same time, genetics has caused havoc in the cholesterol levels. Cholesterol levels are deeply determined by stress levels also. Because of stress, people have gone into binge eating wrong foods, and that interplay has totally caused disarray of cholesterol levels. Well, the testing should be done after 30 years of age or maybe 40 years of age. If you have a history of heart attack at a very young age in your family, let's say your uncle, your dad, your mom, or anyone in the family, the immediate family has had a heart attack or has an angioplasty or a bypass at a very young age, maybe 50, 60, then it's imperative that you look after yourself, start having it as early as 30 years of age. You do need to fast for the lipid test. 12 hours fasting is mandatory. Young people are at tremendous risk of developing heart disease, especially heart attacks, angina. If you have high lipid levels, it's very important to keep the lipid levels in complete check. It is very important to keep your stress level as low as possible, because stress plays a major part in controlling the cholesterol levels. Diet has to be completely in check. We all know what good diet is, and we must, as much as possible, resort to that. Walks, exercise, these are extremely important things. So friends, I don't think you should wait for symptoms to occur to you. I think after the age of 40, if I may say so, do all your regular blood tests. You'll be guided by the doctor you visit, especially lipid profile and all the rest of the tests which he guides you or she guides you with, including a stress test. Because if you do a stress test, you'll come to know exactly where you stand from the heart point of view. So don't have to wait for symptoms to occur. Do all these tests, and if you want to know in detail, visit unmuteyourheart.in and you'll get all ready informations.